سلام، وقت شما بخیر. من دکتر شهریار ناطق، جراح و متخصص کلیه مجاری تناسلی یا اورولوژیست هستم. یه ویدیو آموزشی بودش راجع به در واقع هرنی اینگوینال یا باد فتق. هرنی اینگوینال در واقع که توی عموم به اصطلاح باد فتق شناخته میشه، یه بیماری هستش که در واقع از هر 100 نفر 1.7 نفر در طول عمر ممکنه بهش مبتلا بشن. با افزایش سن شانس ابتلا به هرنی اینگوینال افزایش پیدا میکنه. یعنی دیده شده که در افراد بالای 45 سال از هر 100 نفر 4 نفر مبتلا بشن، یعنی تقریبا 2 برابر میشه. متوسط سن ابتلا در هرنی اینگوینال بین سن 40 تا 60 سال هستش. این خیلی مهم هست که در واقع شما علائم بیماری بشناسید و با توجه به اینکه یکی از خطرات این بیماری میتونه این باشه که روده ها در اون سوراخ هرنی گیر بکنن و باعث انسداد روده و آسیب به روده بشه، قبل از این علامت در شما ایجاد بشه به پزشک معالج مراجعه بکنید. با همین ویدیو رو ببینیم. تو این ویدیو راجع به علامت‌های شایع هرنی اینگوینال صحبت می‌کنیم.
Do you have discomfort or pain when you lift, cough, sneeze, strain, or perform physical activities? Keep an eye on this video. A hernia occurs when an internal part of the body pushes through surrounding tissue, or a weakness in the muscle. Hernia also be caused by people who are constipated and from pushing heavy loads, and people with persistent coughs. While the condition can occur at any age, they are most common in older people because the tummy muscles become weaker. And here are 5 common signs that you might have abdominal hernia. 1. Bulges under the skin. The first common sign you might have abdominal hernia is bulges under the skin. Since the most common form of abdominal hernia is the inguinal hernia, patients develop a bulge or swollen line that travels from the abdomen area to the genital area. It is generally this first warning sign that sends many to the doctor, since it's not a common side effect from anything else. When internal fat or internal organs press through a hole in the muscle, a hernia develops. 2. Acute pain. The second common sign you might have abdominal hernia is acute pain. Hernias can cause discomfort or pain during your daily activities, especially when you exert yourself. They can also cause discomfort or pain during urination or bowel movements and a feeling of weakness or pressure in the groin area. In particular, if you feel pain, pressure, or discomfort while bending down, lifting things, or coughing, and symptoms of abdominal pain become progressively worse, you might want to talk to your doctor. 3. Strangulation. The third common sign you might have abdominal hernia is strangulation, is when a piece of intestine gets trapped inside of the hernia and cannot be reduced back into the abdomen. When this happens, the blood supply of that piece of intestine gets compromised, which leads to a lack of blood flow to the intestine. Obviously, lack of blood flow to the intestine causes severe pain, uncontrollable nausea, and ongoing vomiting. 4. Nausea and vomiting. Another common sign you might have abdominal hernia is nausea and vomiting. Occasionally, patients may have ongoing nausea, and sometimes even vomiting, due to their hernia. These symptoms can be mild and intermittent, or can be more severe. When the symptoms are mild, it is often caused by a small portion of the intestine trapped inside the hernia. When the intestine is able to pump into, and out of, the hernia, the nausea may come and go. This causes intestinal blockages on and off, leading to nausea and vomiting, which comes and goes almost at will. Hernia patients with these symptoms should be seen by hernia specialists as soon as possible. 5. Groin swelling. The last common sign you might have abdominal hernia is groin swelling. Notably, the most obvious symptom for the male patients, the abdominal hernia, tends to cause swelling around the groin area into the testicles. It makes this ailment undeniable to the patient, and often is the reason why so many run to the doctor to get a proper diagnosis. If you think you might have a hernia, you should call your doctor immediately. A healthcare professional will be able to look at your symptoms and medical history and let you know what steps to take from there. Thank you for watching 5 common signs you might have abdominal hernia. Early detection could save your life longer